Hey everybody, my name is Stetson Randolph, and the country we're going to be discussing today is South Africa. Some of the objectives that we will be covering is the different coverages that they offer, the quality, the costs, and the different choices that individuals in South Africa have. All right, let's look at the coverages, guys. In South Africa, you have a private and public hospital system exists in parallels. The public system serves the vast majority of the population, but is chronically underfunded and understaffed. It accounts for 80% of the healthcare rendered in South Africa. The wealthiest 20% of the population use the private system and are far better served. All right, let's look at the quality. South Africa healthcare is ranked 119 out of 195 countries in the world. According to the latest Lancet Health Systems and Quality Index, health quality can be approximated by measuring mortality rates from causes that should not be fatal in the presence of effective medical care. The rankings were compiled by looking at those mortality rates, how healthcare is spread across the population, the cost of healthcare per capita, the healthcare intervention across 11 universal categories. South Africa's strongest healthcare features include diphtheria, tetanus, uterine cancer, upper respiratory infections. They all score at above the 90th percentile in the index. However, the part that the country lacked in are tuberculosis, lower respiratory infections, non-melanoma skin cancers, which all score below 25 on the index. All right, let's look at the cost, guys. Healthcare portion of the gross domestic product. According to the World Health Organization, WHO, the most recent figure in 2014 shows that the total amount spent in healthcare in South Africa wasn't very different from other countries. Okay, South Africa spent about 8.8% of their country's gross domestic product. All right, let's look at that in US dollars. When you compare that to the US dollars, that is about 437 US dollars. So we're gonna look at the government and the private spending. All right, the private spending accounts for 51.76% of the total amount spent. The government spending is 48.24, including funding of public hospitals and government medical workers. Medical aids account for 82.8% of the healthcare spending. All right, guys, let's look at the choices. We're going to break down the hospitals and clinics in South Africa in 2014. Okay, we're going to look at the public sector, and we're going to look at the private hospitals and the private clinics and the public clinics. In East Cape, you have a total of 883 hospitals or clinics. In Free State, you have a total of 281. And Limpopo, you have a total of 522. In Northwest, you have a total of 326. In Northern Cape, you have a total of 159. In West Cape, you have a total of 474, totaling 5,083 hospitals and clinics. Some of my reference, guys. I used the Department of Health of South Africa. I used antiviral therapy in a South African public healthcare settings, facilitating and constraining factors. I want to wish everybody a Merry Christmas and a Happy Holiday.